Right now, thousands of seniors are about to miss a Medicare enrollment deadline they don't even know exists. If you are on Medicare or turning 65 in 2026, this video could save you hundreds of dollars. Missing just one deadline can trigger penalties that follow you for the rest of your life. I am going to walk you through every single enrollment window so you never pay a dime more than you should. Most people think Medicare enrollment is simple and straightforward. They assume they sign up once and everything takes care of itself from there. That could not be further from the truth in 2026. There are new timing rules, updated penalty calculations, and coverage gaps that can blindside even the most careful planner. I spent over 30 years helping folks just like you navigate this exact maze.
I have seen retirees lose thousands of dollars simply because they missed a window by a few weeks. Today, I am laying out every deadline, every penalty, and every little-known workaround that exists. Grab a pen and a cup of coffee because you are going to want to take notes on this one. Let me give you the big picture first, so none of this feels overwhelming. Medicare has multiple parts, and each part has its own enrollment period with its own rules.
According to CMS.gov, over 67 million Americans are enrolled in Medicare as of 2025. That number is expected to climb past 69 million in 2026 as more baby boomers hit age 65. The Centers for Medicare and Medicaid Services updated several enrollment guidelines heading into 2026. Part A covers hospital stays, Part B covers doctor visits and outpatient care, and Part D covers prescriptions. Part C, also known as Medicare Advantage, bundles these together through private insurers. Each of these parts has a different sign-up timeline that you absolutely must understand. Think of Medicare enrollment like catching a series of trains at a station. Each train leaves at a specific time, and if you miss one, the next one might not come for months. While you wait, you could be uninsured and racking up penalty charges every single month. The penalties for Part B alone can add up to $174.70 per month or more in 2026, according to CMS.gov projections. Here is the core problem that trips people up year after year. They confuse the initial enrollment period with the general enrollment period and the special enrollment period. Each window serves a different purpose and opens at a different time. If you use the wrong window or miss the right one, you end up paying late enrollment penalties permanently. Many folks also do not realize that 2026 brings specific changes to how Medicare Advantage open enrollment works. The annual election period dates remain the same, but plan options and costs have shifted significantly. Drug formularies have changed under the Inflation Reduction Act provisions taking fuller effect in 2026. If you are not reviewing your plan every single year, you are almost certainly overpaying. Now let us dive into the first major enrollment period you need to know about. Your initial enrollment period, or IEP, is a 7-month window centered around the month you turn 65. It starts 3 months before your birthday month, includes your birthday month, and extends 3 months after. According to SSA.gov, this is the single most important enrollment window in your entire Medicare journey. If your 65th birthday falls in June 2026, your IEP runs from March through September 2026. Sign up in those first 3 months, and your coverage starts on June 1st, the first day of your birthday month. Wait until your birthday month or later, and your coverage start date gets pushed back by 1 or 2 months. That gap means you could be without Part B coverage when you need it most. Let me put real dollars on this so you see why timing matters so much. The standard Part B premium for 2026 is projected to be around $185 per month based on CMS.gov trend data. If you miss your IEP entirely, you face a 10% penalty for every full 12-month period you were eligible but did not enroll. That penalty gets added to your premium every month for as long as you have Part B. Say you delayed enrollment by 2 full years without qualifying for a special enrollment period. Your penalty would be 20% of $185, which comes out to an extra $37 per month on top of your premium. That means you would additional $440 that you will never get back. Now here is where it gets even more expensive for some folks. If your modified adjusted gross income exceeds certain thresholds, you also pay an income-related monthly adjustment amount. In 2026, single filers earning above $106,000 could pay Part B premiums exceeding $259 per month based on current brackets. Add a late enrollment penalty on top of that, and you could be looking at well over $300 per month just for Part B. Part D prescription drug coverage carries its own separate late enrollment penalty as well. According to CMS, there's Part D penalty is calculated as 1% of the national base beneficiary premium per month of delay. The national base beneficiary premium for 2026 is estimated to be around 36.78 per month. Every month you go without creditable prescription drug coverage after your IEP adds roughly 7 cents per month to your premium permanently. That might sound small, but let me show you how it adds up over time. If you delay Part D enrollment by 24 months, your monthly penalty is about $8.83 added to your premium. Over 20 years of retirement, that penalty costs you an extra $2, $119 in total. And just like the Part B penalty, it never goes away no matter how long you have been enrolled. Some of you watching right now are thinking this does not apply because you have employer coverage. If you or your spouse are still working and have creditable group health insurance, you may qualify for a special enrollment period. This SEP gives you 8 months after your employment ends or your group coverage stops to enroll without penalties. But you must be able to prove that coverage was creditable, and not all employer plans qualify. Here is a mistake I saw clients make over and over during my career. They would retire at 66, lose their employer coverage, and assume they had until the next January to sign up for Medicare. That is wrong, and it cost them dearly every single time. Your 8-month SEP clock starts ticking the moment your employment or group coverage ends, whichever comes first. If you are a veteran receiving care through the VA, your situation has its own set of rules. VA coverage is not considered creditable coverage for Medicare Part D purposes in most cases. You may still want to enroll in Part D during your IEP to avoid future penalties. Always check with both the VA and Medicare.gov to confirm your specific situation before making any decisions. Stay with me, because what I am about to show you will surprise most people watching this video. There is a second major set of enrollment deadlines that even longtime Medicare beneficiaries forget about every single year. These annual windows determine whether you are in the best plan for your needs or wasting money on the wrong one. Missing them means you are locked into your current coverage for another full year. The annual election period, also called the annual open enrollment period, runs from October 15th through December 7th every year. During this window, you can switch from original Medicare to a Medicare Advantage plan or vice versa. You can also join, drop, or change a Part D prescription drug plan during this time. Any changes you make take effect on January 1st of the following year. For 2026 coverage, the annual election period runs from October 15, 2025 through December 7, 2025. If you are watching this video after those dates, you may have already missed your chance to change plans for 2026. However, there is another window I will tell you about shortly that could still help you. The key point is to mark these dates on your calendar every single year without exception. During the 2025 annual election period, Medicare Advantage plans saw significant changes in premiums and benefits for 2026. Some plans increased monthly premiums by $15 to $25 while reducing certain supplemental benefits. Others changed their provider networks, meaning your doctor might no longer be in-network for 2026. If you did not review your annual notice of change letter, you could be paying more for less right now. Let me give you a specific example that shows exactly why annual review matters. Say you were on a Medicare Advantage plan in 2025 that covered dental and vision with $1 monthly premium. For 2026, that same plan might have added a $22 monthly premium and removed vision. CMS.gov, the average Medicare Advantage premium for 2026 is approximately $18.50 per month. But averages hide enormous variation from plan to plan and county to county across the country. Some plans charge $0 per month while others charge $150 or more for enhanced benefits. You must compare plans in your specific zip code to know what you are actually paying for. Now let me tell you about the Medicare Advantage open enrollment period that most seniors overlook entirely. This window runs from January 1st through March 31 every year. If you are already enrolled in a Medicare Advantage plan, you can use this period to switch to a different Advantage plan. You can also drop your Advantage plan and return to original Medicare with a standalone Part D plan. This is enormously important for anyone who realized too late that their 2026 Advantage plan is not working for them. Maybe your preferred doctor left the network, or your prescription costs jumped unexpectedly in January. The January through March window gives you one chance to fix that mistake. Any changes you make during this period take effect on the first day of the month after the plan receives your enrollment request. Here is the catch that surprises almost everyone I have ever worked with on this topic. You can only use the Medicare Advantage open enrollment period if you are already in an Advantage plan on January 1st. If you are on original Medicare, this window does not apply to you at all, and you can only make one change during this entire 3-month period, so choose carefully. I want to share a real-world scenario that shows how powerful this enrollment period can be when used correctly. Imagine you enrolled in an Advantage plan during the annual election period, but did not realize it had a $6,500 out-of-pocket maximum. In January, you are diagnosed with a condition requiring surgery that will likely hit that maximum. By switching to a different Advantage plan with a $3,500 maximum, you could save yourself $3,000 in medical costs that year. The general enrollment period is another window that many seniors do not learn about until it is too late. It runs from January 1st through March 31 each year, and coverage begins on July 1st. This is designed for people who missed their initial enrollment period and did not qualify for a special enrollment period. If this is you, the general enrollment period may be your only way to get Part B coverage. Now here is the part most seniors never hear about from anyone, and it could change everything for you. There are special enrollment periods triggered by very specific life events that most people do not realize qualify. These events can open a window for you to enroll in or change your Medicare coverage outside of the normal enrollment periods. Understanding these triggers can save you from penalties and coverage gaps that would otherwise cost you thousands. Let me walk you through the most common special enrollment period triggers one by one. Losing employer or union group health coverage is the most widely known qualifying event. Moving to a new address that is outside your current plan's service area is another important trigger. Being released from incarceration also qualifies you for a special enrollment period according to CMS.gov rules. If you move from one county to another in 2026, you may lose access to your current Medicare Advantage plan entirely. Most Advantage plans and many Part D plans operate within specific service areas tied to counties. When you move, the plans available to you change based on your new zip code. You have 2 full months after your move to select a new plan without any penalties or coverage interruptions. Another special enrollment period that few people know about is triggered by losing Medicaid eligibility. If you had both Medicare and Medicaid and your Medicaid coverage ends, you qualify for a window to change plans. This is critically important because many dual-eligible beneficiaries rely on Medicaid to cover their Medicare cost sharing. Losing that support means you need to find a plan that minimizes your out-of-pocket costs immediately. There is also a special enrollment period for people who were affected by a government error or plan misconduct. If Medicare or your plan gave you incorrect information that led to a wrong enrollment decision, you can request a correction. According to CMS.gov, you must document the error, are reviewed individually, and can result in retroactive coverage changes. Now let me compare 3 common scenarios so you can see how different enrollment paths play out financially. In Scenario A, you turn 65 in April 2026 and enroll in Part B during the first month of your IEP in January. Your coverage starts April 1st, and you pay the standard $185 per month with 0 penalties. Over 20 years, your total Part B premiums come to approximately $400 at today's rates. In Scenario B, you turn 65 in April 2026, but you wait until August, the last month of your IEP, to enroll. Your coverage does not start until January 1, 2027, leaving you without Part B for 9 months. You still avoid the late enrollment penalty, but any medical expenses during those 9 months come entirely out of your pocket. A single emergency room visit during that gap could cost you $5,000 to $15,000 or more. In Scenario C, you miss your IEP entirely and do not enrollment period the following January through March. Your coverage does not begin until July 1, 2027, more than a year after your birthday month. You also face a 10% late enrollment penalty added to your premium for the rest of your life. Over 20 years, that penalty alone costs you an additional $440 on top of your regular premiums. I want you to look at those 3 scenarios and really let the numbers sink in for a moment. The difference between Scenario A and Scenario C is not just money, but also months without any doctor visit coverage. During those uncovered months, you are one medical event away from financial disaster. This is why I say Medicare enrollment is not something you can afford to figure out later. Let me now walk through how Part D enrollment timing affects your prescription drug costs in 2026. The Inflation Reduction Act capped annual out-of-pocket prescription costs at $2,000 starting in 2025. This cap remains in effect for 2026 and applies to all Part D plans and Medicare Advantage plans with drug coverage. But you only benefit from this cap if you are actually enrolled in a plan that provides Part D creditable coverage. If you are taking a brand-name medication that costs $500 per month at retail, that is $6,000 per year without coverage. With a Part D plan under the $2,000 cap, your maximum annual out-of-pocket cost for prescriptions is $2,000. That is a savings of $4,000 per year just by being enrolled in the right Part D plan. Delaying your enrollment even 6 months could mean paying full price for medications during that gap. Many Part D plans in 2026 also offer a new payment smoothing option called the Medicare Prescription Payment Plan. This allows you to spread your out-of-pocket prescription costs evenly across all months of the year. Instead of paying a large amount when you fill an expensive prescription, you pay a predictable monthly installment. According to CMS.gov, this option is available through all Part D plans and Medicare Advantage plans with drug coverage in 2026. Here is the hidden gem that almost nobody talks about, and it is the reason I saved this part for now. There is a provision under Medicare rules that allows certain low-income beneficiaries to get extra help paying for Part D costs. This program, also called the Low-Income Subsidy, can save you up to $300 per year on premiums, deductibles, and co-payments. Yet according to SSA.gov, millions of eligible seniors never apply because they do not know it exists. To qualify for extra help in 2026, your annual income must be below approximately $22,590 if you are single. For married couples living together, the income limit is approximately $30,660 per year. Your total resources, not counting your home and car, must be below $17,222 for individuals or $34,360 for couples. These numbers are adjusted annually, and you can verify the current limits at SSA.gov or by calling 1-800-772-12-334. To 115-7 Semis 30 Felt telling 139. Turned per dumantu prash $3 RU Sinjin to leda to Pew 1 number dollars months. Your trade sure use to you. Your trade sure use to means you can switch Part D plans at any time, not just during the annual election period. This gives you incredible flexibility to find the best plan for your specific medications whenever your needs change. Even if your income is slightly above the extra help limits, you may still qualify for partial assistance. The Medicare savings programs run by your state Medicaid office can help pay Part B premiums, deductibles, and coinsurance. The Qualified Medicare Beneficiary Program covers Part B premiums for individuals with incomes up to 100% of the federal poverty level. The Specified Low-Income Medicare Beneficiary Program covers Part B premiums for those with incomes up to 120% of the poverty level. Now let me tell you exactly what you should do today to protect yourself and your wallet. First, go to Medicare.gov and use the Medicare Plan Finder tool to compare all available plans in your zip code. Enter your specific prescription medications, preferred doctors, and pharmacy to see accurate cost estimates. This free tool is updated for 2026 plans and takes about 15 minutes to complete. Second, call 1-800-MEDICARE, which is 1-800-633-4227, and ask a counselor to verify your enrollment status. They can confirm which parts of Medicare you are enrolled in and whether any penalties apply to your account. The phone line is available 24 hours a day, 7 days a week, with TTY service at 1-877-486-2048. Write down the name of the representative and any reference numbers they give you for your records. Third, contact your state health insurance assistance program, also known as SHIP, for free one-on-one counseling. SHIP counselors are trained volunteers who can help you compare plans and understand your enrollment options at no cost. You can find your local SHIP office by visiting SHIP Help.org or calling 1-877-839-2675. These counselors have no financial incentive to steer you toward any particular plan, making their advice truly unbiased. Let me bring this all together so you walk away knowing exactly what matters most from today's video. The single most important thing you can do is know your enrollment deadlines and act before they pass you by. Missing your initial enrollment period can trigger permanent penalties that add hundreds of dollars per year to your costs. Missing the annual election period can lock you into the wrong plan for an entire year. If you found this video helpful, I would be grateful if you hit that subscribe button and the notification bell. I put out new videos every week covering the latest changes to Social Security, Medicare, and retirement benefits that affect your wallet. Next time, I am going to break down exactly how the new Medicare prescription payment plan works and how to set it up step by step. This channel is for educational purposes only and does not constitute financial or legal advice. Always verify directly with SSA.gov or Medicare.gov